Welcome to the Locality Partnership Forum. My name's David Law. I'm the Chief Executive of Hertfordshire Community Trust and I'm also the Chair of the Integrated Care Programme Board on the west of the county. I want to talk to you today about the work that we've been doing on integration and the task that faces us ahead. The challenge facing health and social care is one of sustainability, and by that I mean our ability to meet the demands on the services which are growing considerably against a resource that's fairly stable. So sustaining delivery of health and social care is the task that we face together. We're seeing a growing number of elderly people, a growing number of people with long-term conditions and a growing number of people with 3 or more long-term conditions, all of which place demands on health and social care. We currently spend already about 70% of our budget on people with long-term conditions, and we are seeing that number of people increase. So we have to change the way we work in the future in order to maintain the delivery of health and social care services to our communities. From the work that we've done on Your Care, Your Future, it's very clear that future demand will outstrip our ability to meet it if we deliver services in the way that we do now. The purpose of what we're doing is to improve the health and well-being of the people in the communities that we serve. We also need to manage end-of-life care well, but specifically for those people that we work with, we need to improve the outcomes of their care, we need to improve their experience of care, and we need to reduce costs. 3 things that we need to focus on continuously. We're supporting people to maintain their independence and working to reduce reliance on institutional care. So I'd expect fewer people to go into acute hospitals and people to be either delayed or not need to go into residential care. To understand that task, I think of our population in 3 levels. There's broadly 10% of the population who use about 45% of health and social care resources. The task we have with that element of the population is to coordinate their needs more effectively, for us to work in a more integrated, a more joined up way than we have done. And we found the benefits of that in the multispecialty team in Watford. The next layer of the population, around 20%, are people typically with 1 or 2 long-term conditions. What we need to do for them is work to support them to manage themselves to a greater extent. Evidence shows that where we do that, we get better outcomes for those people, and we need to reduce demand on our services. That's fundamental for us. That leaves 70% of the population who are pretty well, but actually many of them are starting to age, and we need to ensure that they age well, that they remain active, they remain socially engaged, and think about how they're going to live their lives as they grow older. And build community resilience. We need to engage people and communities in the work we're doing. That's really important. The 5-year forward view talks about empowering patients and engaging communities as being central to the task that the NHS and social care face. We've started this work with developing a multi-specialty team in Watford, and we were discussing that at a meeting I was at this morning, last week for you, and there was a real sense of achievement about what the team has delivered, a real sense that they've been persistent and come together in coordinating their services, and that they work far more effectively because they're working together to deliver a very focused and personal service for the person that they're dealing with. What that's shown us is the real benefits of joint working, and we need to extend that to other areas. We need to draw on the learning from that team, those people who've been involved, acknowledge what they've experienced and use that to inform how we extend that way of working to other areas. So what happens next? Well, we need to build the multi-specialty team approach in other localities, and I'm sure that's something you'll discuss today. We also need to extend that coordination to a larger percentage of the population, and we need to identify who those people are do the risk stratification that's common in many other systems. We need to develop a programme of self-management, a whole system approach to people supporting themselves, to being supported in their communities, to supporting each other, so that they lead healthier lives for the future. And we need to think about how we approach prevention, working with a wide range of bodies to maintain people's health and well-being, particularly as they go into older age. So I'm sure you'll have some fruitful discussions today, picking up on those themes. The message I would want you to take into those discussions is that whilst we are working on clarifying the specific objectives we want to deliver, we want to support you to find the best ways you can locally to deliver the changes that we need. We want you to be creative, imaginative and resourceful in the way that NHS and social care staff can be. We don't want you to ask our permission to do things. We want you to go out there and find the best way in your locality of delivering the improvements in services that I've talked about, and I'm sure colleagues will talk about more today. So I hope you really enjoy the sessions. I've certainly found the discussions we've had as we've gone through the journey on developing our approach to integration fruitful, and we need to extend those conversations to as many colleagues as we can and really start to change what we do for people in this community, in all of our communities, and to improve the lives of the people that we serve. Thank you.